to page 47. It's Bates 47, please. And there's a comment at the bottom based on Dr. Miklos' exam. I'd like to focus on that. That's it. It says comments. Mesh arms palpable and guitar-like in both the distal and posterior vaginal wall at the urethra and proximal at insertion in levator anine muscles. Palpation of the sling and arms of anterior wall mesh is the point of maximum discomfort and putting the patient into tears on the table. This is a blind exam. The patient, she did not know where I was touching. Is that significant to you?
Yes.
Why is that?
So this is significant because it's demonstrating the correlation between the findings on examination, where he's finding this very, very clear and severe picture of mesh contraction and what it's doing to the arms and the body of the mesh, and how that produces her pain by palpating on that.
Why is that important, clinical correlation? What's that telling us?
That tells us that this is clearly the mesh causing her pain. Dr. Miklos pushes on the mesh, that's her pain.
When he talks about the mesh arms being palpable, the mesh being palpable, what is that? Why is that important?
So the fact that they're palpable and guitar-like in his description means that they're taut. What happens, I know you saw the picture in opening, where the effect of contraction is the mesh arms pulling on the central body. So what Dr. Miklos is finding on his examination is where those mesh arms are pulled, are taut, guitar-like, which is confirmation of the process that's been going on ever since the mesh implantation, the contraction, with this as the result.
And also the idea that they're, well actually we'll move on. Let me do it this way. Take that down and we'll go now to Exhibit 3353. We put up Exhibit 3353, which is a PowerPoint slide from the defense opening. Have you seen this?
Yes.
And I'd like to focus on where it says the arms designed to replicate the natural tissue bridges. Do you have an opinion about that statement?
Yes.
Please tell us.
There are no natural tissue bridges that go through the obturator foramen. That, like I said, the obturator foramen is closed off, except for a very small part of it for the obturator bundle, closed off by this very firm layer of connective tissue with the obturator internus muscle on the inside, the obturator externus muscle on the outside. There's no natural tissue bridges there that have any connection to the vagina whatsoever. The arms on the anterior Avalta implant are not providing support. They're only a mechanism for getting the mesh into the anterior vagina where you want it. That's not where, at least where it was designed to be placed. Doesn't have anything to do with support whatsoever.
And when you talk about the arms, is that the area that Dr. Miklos said was palpable and guitar-like, and she had pain on palpation of that?
Yes.
And when those arms are put in, by the way, in terms of tension, what happens to the Avalta, to the arms and to the central portion when they're pulled in?
Objection, Your Honor. It's foundation for her.
Okay.
Ask a few more questions.
Are you familiar with how the Avalta procedure is performed?
Yes.
Have you watched the surgical videos showing the performance of the procedure?
Yes.
Have you read the IFU?
Yes.
Have you studied the descriptions of the procedure in the internal documents and in the depositions of the witnesses?
Yes.
When the arms are pulled in terms of the tension, what occurs with the arms and the body of the mesh?
What happens when the mesh arms are pulled to get the central body mesh into place is that they undergo pore collapse. It's this mesh arm that's 1.2 centimeters wide but the needle introducer doesn't create a tissue channel for it, so it's, being dragged through the tissues, and that forces it into a crumpled position, which increases that local mesh burden and effectively collapses all those pores of the mesh arms. And at the same time, you have the central mesh body, but the way the mesh arms are pulled in order to seat the central mesh body, and I think you saw some of this on the video, that also collapses the pores of the central mesh body, and they lose their effective porosity.
Your Honor, I'm going to move to strike that. It goes well beyond the question, and it goes well beyond her experience.
We'll think it answers the question.
What you just described with the arms, you can take that down, we'll prepare for the next exhibit, but what you just described with the arms and that process, do you have an opinion as to whether that's medically safe or unsafe?
Yes,
What's your opinion?
it's completely unsafe.
Does it have any benefit to the woman in terms of trying to treat her prolapse to use those arms?
No,